Hello, my name is John Williamson. I am clinical trainer for Atlantis Medical. I have got a little bit of a demonstration here. You can see our neonate, our baby, and a baby, for the purposes of our demonstration, is considered to be less than 1 year, so 0 to 1 year. Now, when you are attending to or performing first aid, basic life support for a baby, you essentially have to be aware of the same sequence of steps as an adult. So we have the mnemonics doctors A, B, C. Now, D for danger, R for response, S for shout, and A for airway, B for breathing, C for circulation. So I have come across a baby who is not responsive, possibly unconscious baby. Now, what is the first thing I need to do? I need to assess the situation, make sure that the environment is safe for myself and for any body coming as a responder, coming to help. And I need to do that very promptly. Now, the next thing I need to do is draw near to the baby and support the baby, because you are going to be needing a hard surface in a moment, but you want to support the baby to try and obtain an R response from the baby. So you want to see whether the baby is conscious, you want to see whether you can get some verbal response from the baby, and you want to make sure that the baby can respond to some level of stimuli, touch stimuli, okay, which is spontaneous. So you want to just gently, okay, just tap the baby on the shoulder, stroke the baby, just to get where the baby, the earlobes, just stroke, not pinch or anything, for a response. And speak to the baby, talk to the baby. Now, if you're not getting a response, what you want to do while supporting the baby on a firm surface, you would proceed to examine the airway. But before you do, send for help, shout for help, ask for somebody to dial 999. And if you are in the clinical unit, then you use the number, which is usually 2222. And when you are examining the baby, what you need to do once you've got the baby on a firm surface is to place your hand on the forehead, supporting, not weighing the baby down, and then gently place the tip of your finger, one finger will do, under the baby's chin, and just gently to the neutral position. Make sure that you unblock the airway and you can look inside, okay? Hand on the forehead, finger on the tip of the chin, just gently. You have to do it in such a gentle way that you do not dig into the skin. You have to make sure, because the skin of the babies needs tender loving care. And so with the forehead supporting, you just place the baby, lift gently to the neutral position, not full way back, not tilting the head back as you do with an adult. So at the neutral position, the airway is now unblocked, and you want to see whether there is any obstruction to the airway. If there is an obstruction to the airway, what you want to do is gently pick it up, if it's an object, without inserting your finger in the baby's mouth, because when you do, you run the risk of pushing this object further in. Obviously, if it's a liquid obstruct, like an aspirate, you want to turn the baby round, and with the aid of supporting the baby with the aid of gravity as well. You want to turn the baby round, and if you're in the clinical area, you want to use some form of a suction, and I won't go into more detail about that. I am not a pediatric first aid trainer. Now, for all intents and purposes, tilting the chin to a neutral position has unblocked the airway. If the baby's airway is unblocked, you now want to check through the look, listen, and feel technique by just placing your head really close to the baby, your ears close to the baby, with your face pointing down the baby's chest. You want to look at the movements of the chest. You want to listen at the breath sounds, and you want to feel it on your cheeks to see whether the baby is breathing. If the baby is breathing, then obviously that's an opportunity to facilitate the airway, ensure that the baby continues breathing. Okay, but if the baby isn't breathing, then what you need to do next is go from B to C, which is cardiac compressions, and we will go into more detail about that in the next video. Thank you.